I had an exposure at work. One of my fellow nurses said her spouse had tested positive for COVID. So initially, my symptom was a fever. I'd had a fever for probably close to about a week. The fever disappeared for a couple days, so I thought I was fine. And then the fever came back along with shortness of breath and a cough. But my initial appointment, I actually felt really discouraged because the doctor basically said, there's nothing that we can do for you. At the time, I was having chest pain. That was really, really scary. I don't have a health history. I'm healthy, and I just had this ongoing chest pain that would not go away, and it was worrying me. I had different kinds of chest pain, to be honest. I would say one was kind of like chest pressure. And then I had this feeling, it's hard to describe, but kind of like a sharp and throbbing pain, like in my lower lungs. The chest pain, actually, I still have the chest pain. It's not constant, but it occasionally will pop up. It's very, very strange. I could barely feed myself. If I didn't have my landlords there, I don't know what I would have done, because they were nice enough to go out and get all the prescriptions that were put in for me. They made me meals. They went shopping for me, because honestly, I had no energy to do much of anything. Actually, I think one of the worst things about this disease is kind of the fear that you're going to pass it to someone. So when you are sick, you really have to isolate yourself. And just feeling the way I felt and being by myself was terrible. That was another part of this whole thing, is mentally it takes a toll on you. And I find that the more you worry and the more you read about things, the worse you start to feel, and you start to expect the worst, basically. I noticed people that I know personally, they may kind of feel like they have symptoms, or they could be sick, and they kind of brush it off. And I feel like with this, I feel like if you have like the slightest, symptom or inkling that you might be sick, I really think the testing is really important to do, as soon as possible, because the sooner you know, the sooner you can isolate yourself and not be around people and exposing people. I kind of wish that I had done that, which I know sounds kind of strange, because I am in healthcare and I should know better. But for that week that I had a fever, I kind of brushed it off as, oh, it's not COVID, it's probably, it's something else. And then I started to feel better, and I was like, okay, so, I'm fine now. I went around people, which I still feel terrible about. And then I started to get more and more symptoms. And I feel like when I had that fever, I should have clicked for me to go and get tested then. I absolutely get people wanting to get back to a normal, we have to at some point, but that doesn't mean we pretend that there's no risk and that this virus, it doesn't exist, because it's just going to keep being a cycle where our numbers are going up, and then we can't go back to normal because we're deciding not to face the facts and take the precautions that we need to take in order to go back to normal.